want to kind of come and do a little bit more of an assessment on you. I just want to check a little bit more of a neuro exam. Is that okay with you? Is this a good time? Mm-hmm. Okay, good. All right. Okay, so can you tell me what city you're in?
Denver.
Okay, and your name?
Barbara Bauer.
All right, and what day of the week is this?
Thursday.
Okay. All right, so patient is alert and oriented to person, place, and time. Speech is clear and understandable. And let's see, and behavior is appropriate for the environment and situation. All right. The face is symmetrical. And I'm going to check your pupils right now. Do you mind? Okay. All right, so the first thing I'm going to do is, and you guys, we're going to have our own pen lights that already have your pupil scale on them. So I'm just going to go ahead and can you look at me, please? Thank you. Okay. All right, and then I'm going to shine a light in your eyes. I just want to check your pupil response. Thank you. Okay. So pupils are 2+, round, reactive to light with and then can you follow my pen light, please? Thank you. With accommodation. All right. Okay. And I've already said that the face is symmetrical. All right. Can you do me a favor? Can you lift your eyebrows? Can you smile? Can you frown? Can you, what's the fourth thing? I always miss one. Can you puff your cheeks? Good job. Okay. Cranial nerve 7 is intact and appropriate. All right. And then I'm just going to shine a light on you and look inside your mouth. And actually on this one, you guys, it probably wouldn't hurt to have them sitting up. Right now, I'm not going to do that to her. I'm just going to finish this. Oh, so
I did sit if you want, but okay.
Yeah, I'm all right. Okay, so I just want to put the tongue right here. I'm going to shine a light back there. Can you say ah for me? Okay. Cranial nerves 9 and 10 are intact. Uvula is rising, so they're intact. So see, you guys, it says rise of uvula. I want you to say that. All right, okay. And then can you please stick out your tongue as far as you can, please? Okay, tongue is midline. Cranial nerve 12 is intact, and, well, it's intact. That's all I'm going to say. All right. And then I tell you what, this one she should stand up for, sit down for. Okay, can you sit up for me? Okay. All right. I'm going to have you shrug your shoulders, please. Okay, yeah, good job. And I want you, can you please turn your head to the right? Good. Turn your head to the left. Good. Cranial nerve 11 is intact. And since she followed those commands, I'm going to count that as an ability to follow a one-step command, okay? So you can say, and she did follow multiple commands to test her cranial nerve, so we've covered that one too then. You see what I'm saying? Okay. All right, and then, all right, so now I'm going to grasp fingers. Okay, can you squeeze your hand? Squeeze my hand as hard as you can. Okay, now I'm going to try to flex your feet, go against me flexing. Okay, now I want to extend your feet. Okay, all right, hand grasps and flexion and extension of feet bilaterally are appropriate. Okay, all right. All right, and then can you close your eyes for me, please? Okay, can you put your hands out for me? Just kind of put them out in front. Okay, tell me when I am touching you.
Touching, touching, touching.
Okay, and okay, you can put your hands down. Okay, and tell
touching.
me. Okay, thank you.
Touching.
Okay, so no signs of paresthesia. And we're good. So that's the end of the focus exam for neuro. Any questions? Okay.
Should we say strength
Neuros.
is 5 out of 5 muscle strength?
Actually, that would be a good idea.
Okay.
Yeah, I mean, it doesn't really, again, you can say it either way.
Okay.
Okay, because it doesn't say how to express muscle strength of upper and lower extremities. It just says to test them. So on the ones that it doesn't really say what to do, we're fine with going ahead and just letting you express it whichever way. I mean, again, you guys, I saw the action of bilateral squeezes and then testing of the leg, of both feet. Okay? All right. Okay, now moving right along, we are going to go into the respiratory exam. And as you can see, though, you guys, even though, you know, I had to kind of look at myself, I don't think I went 10 minutes, did I?
You went
Okay,
4.
so see, not even close. All right, so, you know, I don't think time is going to be the element with you guys, so I would say just make sure you've got it nailed and you're going to be good. All right. Okay, so, Ms. Barb, can you tell me your full name?
Barbara Bauer,
Okay, and what day of the week is it?
Thursday,
And what city are you in?
Denver.
Thank you. Okay, and have you had any shortness of breath or cough? Or, yeah,
I've had a cough.
and any pain in your chest with breathing?
No.
Okay. All right, so now I'm going to assess the color of the mucous membranes. So what I'm going to do is I'm going to put her, pull her eyelids down, and I'm also going to ask her to open her mouth, and I'm going to look at the top, look at her gums, and the gums are pink, moist, and intact. All right, and the respiratory pattern is unlabored. It's bilateral with good chest rise. All right. And now, and you guys, I don't care when you do it, but I'm going to check now for chest expansion. Okay, because I'm not going to do the sputum stuff yet. All right, so I'm going to have her turn around. So stand up and turn around for me, would you? Okay, and you can do this seated as well, just so we can see that you're doing it right. All right, so I'm doing the thumb routine, and see how high I've got my thumbs. I've actually got them pretty high. You know, place them not too far below the scapula, okay? And then go ahead. Okay, so Barb, can you take a big breath in for me? Okay, and breathe out. Okay, now, this was an example where it would have been a much more dramatic change had we just had the skin. Okay, but through the scrub again, it was blunted. Okay, you can sit back down. Okay, and at this point too, I'm going to palpate the trachea for midline. Okay, so again, you guys, we want to take it where your thumbs are. Let's see if I can do this so everybody can see. So it's kind of like you've got your fingers on both shoulders and you're just going up and down. Trachea is midline. Okay, and I know I'm forgetting stuff. I'll go back to it. Okay, and all right. So, do you have any sputum? Are you making sputum with your coffee? Is your cough productive?
Big, ugly green stuff.
Okay, all right. At this point, we're going to pull out the cup, okay? And it's going to, be the regular sputum cup. And you're going to have to describe the color, the consistency, and the amount. So you're going to say, okay, this looks lovely. It's thick green sputum, and there's about 20 milliliters of it, okay? All right. And then now what I'm going to do is I'm going to go ahead and auscultate for breath sounds. Okay. All right, so now this is where we do maximum amount of breath sounds here. All right, so again, we're going to go, this is number 1, anteriorly. And actually, you can either do it here or you can do it here. Personally, I don't care. I always actually go up to the shoulders because I've caught breath sounds that are bad even up in here. Okay, so 1, big breath in, please. And again, you guys, you've got to instruct your partner. You just can't, and that's another place where I don't want you guys all of a sudden to start taking these deep breaths when the nurse, when she's going to come along, because you know what's going on. So, okay, so take a deep breath for me. Okay, and over here, this is 3, 4, and see, I always just kind of palpate my intercostal spaces. 5, 6, and I'm kind of going down here. 7, 8, and then big breath again. 9 at the bottom of the bra, and 10. Now, you notice I haven't gone laterally yet.
It's only 8 in the front.
Oh, that's right. I'm sorry, you guys. I was thinking back. I'm sorry. See, it's hard to remember all this stuff. Okay, so I'm going to do the 8 on both sides. So remember, okay, can you lift your right arm for me, please? Okay, so just remember, you guys, we've got to see one of them at that 5th intercostal, basically at the nipple, which is that right middle lobe again. That's definitely one of the lateral ones that we need to see, okay? All right, so anyway, but then we can kind of go, I zigzag just because I go anterior, posterior. Okay, big breaths for me, please. Okay, and then here's this one. Okay, this one. And this one. Okay, you can put that arm down. Can you please put your left arm up? And breathe. Breathe deep. Deep breath. Deep breath. Deep breath. Okay. All right. And also, because this is the lung exam, though, I still have to check the apex of the heart. Okay? So I'm going to do that as long as I'm in the neighborhood. Again, you guys, you can do this in your own steps, just so you're doing it. So again, we're going to kind of go right in this area. And you've got to, and we're not going to make you do it for a minute, because we know that time is of the essence since this is a timed exam. But I do want you to hold it, listening with the diaphragm for a few seconds, long enough to make sure that I know that you know what's going on here. Then I'm going to do the bell. Same thing. So just breathe normally on this, please. Okay, so heart rate is regular. There are no gallops, murmurs, or, don't tell me, rubs. Okay. Okay, I was going to say, don't tell me. I have to know this myself. Okay, now I'm going posteriorly. And I tell you what, I'll have her turn around and have the back to you guys so you can see exactly where I'm going. All right. Okay, so again, I'm way up in here. And again, you want to make sure that you're not going over the scapula, because you're not going to hear anything over those guys. Okay, so can you take a deep breath for me? Good. 1, 2, and follow the scapula, you guys. When you look in your book, at least 6 of your 10 auscultatory sites are right along the edge of the scapula. So if you think of it this way, the first 2 are at the upper back, kind of on either side of the neck. The next 6 are along the scapula. The last 2 are right at the bra strap. You've got your 10 sites right there. Okay, so that's my advice. Still keep breathing for me. Breathe this, normally just a little bit deeper. Good. Good. And then here. And then kind of fan out like you're supposed to. You're not going laterally totally, but you are going, a little bit toward the lateral side of your back bilaterally. Okay. So those are the 10 auscultatory posterior sites. Any questions? Okay, and let's see here. Okay, I can't remember if I checked the plane here. Yeah. Okay, so, yeah. Okay, all breath sounds auscultated were clear, without rubs, wrong list, without Ronchi, wheezes, stridor, rubs. I always get 4 of the 5. Crackles, thank you. I always get 4 of the 5. Okay. All right. So, did I miss anything? Oh yeah, we got to expect the fingers for clubbing. I couldn't remember if this was now or in the cardiac. Okay, you guys, have you seen this? Okay, you may not have seen this maneuver before. Okay. It's where you put the backs of your fingers together. And so first point them down, so you kind of make sure you got them where the pads of each finger are meeting. Then turn them up and look. In clubbing, the tips of the fingers they're not going to join like this because they're clubbed, and so you're not going to have the same thing. So I want you to demonstrate to your patient how to do the clubbing. So you're going to have to teach your patient, you're going to have to show them how to do this, and then you're going to look at the pads of all the fingers, okay? All right. So no clubbing seen bilaterally. Okay, so now the last thing is that we know that, I can tell you right now that your case study involves someone with pneumonia. So what we want you to do is we just want you, I'll have you stand up again so they can see. We're just going to have you percuss basically the 6 auscultatory sites. Okay, so up here. Okay, so there is resonance in all lung fields on percussion.
Can you say there's no presence of dullness?
You can say there's not, you can say, you can either say it there is what there is or what there's not. I just said what there was, and it tells me the same thing. So you can say there's no dullness in any of the lung fields on percussion. All right. So that's the pulmonary one. Did I miss anything, guys?
I have a question real quick. On the lateral then, it's okay to do the whole side and then go with the other side?
For the purposes of this exam, it is.
It just seems to go faster than...
Absolutely.
You certainly can do anterior and then go ahead and do your lateral like that. I think it's more rhythmic. Do you know what I mean? Fluent.
Yep. Yeah, I just did it up, and we don't care whichever way. We just want to make sure that you listen to 4 breaths on each side laterally.
Because it says 7, but it doesn't matter if you do 8.
Well, we decided to make it easier on you and just say 8. The reason that the left is only 3 is because there's only 2 lobes on the left.
It says 7 in the book, so we're doing 7 or 8.
Do either one.
Okay.
Yeah.
Can we just follow the book?
Yes.
And
Yes, you
on
can.
both right and left.
You can do back and forth like she said, or you can do up and down like I did on lateral. That part we're not gonna care on. Okay, we just want to make sure that you're auscultating 4. Basically, if you miss 4 on this side, we're going to count you off because this is the side that's got the 3 lobes. If you only do 3 over here, this is only a 2-lobe lung here. So I'm not going to worry if you do 4 or 3. But over here, you better do 4. You've got to do 4 on the right. Let's say that's the must do. Okay, on the left, we can go either way. Okay, let's go to the cardiovascular exam. Okay, and on this one, I'm going to start lumbar flat. Okay, are you flat? I guess you are. Oh, the mattress kind of draws up a little bit, but the bed's flat, the frame is flat. Okay, you guys, and don't forget, got to know how to operate these beds because we've got legends where people took 5 to 7 minutes of their 15 to figure out the bed. You better know it before you come. So whichever bed that you're in that's mechanical, you don't know which bed, so you need to know how the beds work on all of the beds. We're probably going to be on this one and that one over there with the mannequin. Okay, so just make sure you guys know how to get the heads up and down. Hey, kids in the hospital, you're gonna need to know it. Yeah.
So when our patient is in the bed, we put both rails up, and then if we ask her to sit up, should we put one of the rails in?
I'm not caring about side rails. This is not the side rail / restraints class, okay? This is the head to toe assessment class, or the focus exam class. You can have all 4 of your side rails down, okay? All right. Okay, now cardiac. Okay, so have you had any chest pain? Well, yeah, because you're a suspected MI. That's what you are. You are.
I had a little bit of chest pain, yeah.
Yeah,
I don't know
okay.
if it was the pizza I ate or chest.
Okay, and have you ever had the sensation that your heart is beating like it wants, beating irregularly, or have you ever had it feel like it wants to jump out of your chest?
Sometimes it'll go really fast.
Okay, all right, so what I'm gonna do is I'm gonna look for skin color, and you know what? I did not do this in the last class, okay? You don't need to do that, okay? I just kind of went revised back, but I would like you to feel, just a little bit, because you want to reestablish that skin is warm and dry, and I think again we got to do the mucous membranes if I remember correctly. Yep. Okay, and then conjunctiva or mucous membranes are pink and are pink and moist and appropriate to the situation. So again, I look at her gums as well. All right. Okay, now what I'm going to do, can you do me a favor and turn to your left, please? All right, now I'm looking for the jugular vein. All right, I don't see it flat. So what I'm going to do at this point is raise the head to 45, where she continues to look to her left. Okay, at 45 degrees, there are no signs of jugular venous, or I don't care if you say jugular vein distension at 45 degrees. But don't say JVD, okay? All right, so there's that one. All right, now at this point, I'm going to go ahead and I'm going to perform apical radial and look for pulse deficit. And I may be out of order, I hope not. Oh, okay, well, I'll come back to the 5 heart sounds. Again, I'm also giving you an example of how you can be out of order just so you hit them all, okay? All right, so now what you have to do, though, to do your check for your pulse deficit, I want you to go down to the apex again, and I want you to put your hand on the radial pulse, and I want you to make sure that when you hear the heartbeat, you feel the pulse. And do this for only, 10, 15 seconds, just enough to make sure that I know that you have your diaphragm placed properly and that you've got your hand on the radial. All right? Okay. All right. There is no pulse deficit between the apical and radial pulses. They're present in both areas. Okay? Now, I may ask you, though, or I don't know, I may ask you, if you have me, I may say, okay, I know that we just checked it for a few seconds right now, and this is fine for the purpose of this test, but for how many seconds would you actually do palpation if there was a question that the heart was beating irregularly? 1 minute. That's the answer. Okay. So we may ask that, we may not, but that may be the only question that you even hear from us, and we may choose not to even ask it because we're grilling it into you here at practice. All right, now I'm going to do heart sounds. And on heart sounds, you guys, I would like to see you actually trace out your intercostal spaces, okay? Because this is where it becomes very important. And, okay, so I am at the edge on the side of the sternum, and I'm at my second intercostal, and I'm going to go for, this is which Terry? Which valve am I auscultating? Second intercostal on the right, right next to the sternum. Thank you, aortic. Good job. And you've got to use your diaphragm and your bell, all right? Now, if you choose to use your diaphragm, I'm sorry, am I hurting you? I'm kind of
No.
pressing. Okay, good. You can do it either one of two ways. You can either go through all 5 of your cardiac sounds with the diaphragm, then go back and do all 5 with the bell. Whose is that?
Mine, sorry.
Okay.
You don't listen with the bell to Herb's point. It's just the 4 sounds that you listen with the bell. Because
Okay.
you don't hear any murmurs or anything over Herb's.
Okay.
Just, I was just,
Okay.
that's, we're working together.
Yeah, okay. All right. See, I didn't get in on all this stuff, because this is when I was laid on the beach in Florida when we did this day. Okay. So anyway, all right. Now, in my case, I choose to do it both at the same time because you get you get each point, you hear it both ways. But I don't care how you guys do it, okay? All right. And again, you don't have to listen for a full minute. Just so I can tell that you either went and did all 5 of them with the diaphragm and then went back with the bell. You don't even have to listen to it for too long. Okay. Okay, now this is, okay, so what intercostal spaces make up 4 of the 5 sounds? In other words, which numbers are you on when you're palpating to get your landmark for doing your auscultating? Second intercostal, third intercostal, fourth intercostal. And the mitral, I think, is the 5th intercostal. Okay, so if you keep those in your head, then you're going to be good. Okay. So now I'm in 4th intercostal. And then I would be going to 5th intercostal, which is mitral valve. So it's apex, correct? Same for both? Okay, good job, you're right. So, like I said, either way, diaphragm, all diaphragm sounds, then all bell sounds, which is 4 of the 5, and or do it at the same time, I don't care. All right. All heart sounds are appropriate, are normal, and without any rubs, murmurs, or gallops. Okay. All right. And okay, now we go back and auscultate. We partially auscultate the lungs, even with the heart. Even in the cardiac exam, just as we auscultated the cardiac in the pulmonary exam, but just abbreviated. So we're going to actually go just second intercostal again. Can you take a deep breath for me, please? Good, and then I'm going to go back. And you guys, this is your anatomical landmarks here where it says lateral location 5 and 4 and 3. This was from an old textbook, so I'm just saying to you what we actually want is a second intercostal, and for both right and left. And then can you please lift your right arm for me? And then we want you to go to the anterior 5th intercostal space, anterior, to catch that right middle lobe. Take a deep breath for me, please. Okay, all right. All right, now, and again, you guys, this is why we have the shorts on, because now you can put your arm down now, I'm sorry. Go ahead. Oh, well, whatever, I don't care then. Okay, so now we're going to go, okay. The breath sounds were clear with no wheezes, bronchi, crackles, stridor, or rubs. Okay, good, all right. And you can do this just like I did. I mean, if that helps to keep that going. All right, so now we're going to go and I'm going to palpate the radial and dorsalis pedis pulses. And at the same time, I'm going to check both forefingers for capillary refill. And then again, no socks on, that's Skin Lab. Then I'm gonna palpate and you guys always, if you have two of anything, palpate both sides at once, because if you're going to hear, or if you're gonna feel an abnormality, then you can immediately compare it to the other side, okay? All right. Okay. And then pre-tibial and pedal edema, you can either go like so, you can go like so, and just palpate. Okay, the lower extremity skin is warm, dry, with no signs of pretibial or dorsalis, with no signs of pretibial or pedal edema. Okay, is that all for that one? Okay. Oh, okay. Yes. Oh, Laura, okay, I didn't say that. Warm and pink, warm, dry, without pretibial or pedal edema. All right, and then capillary refill. I just did the forefingers, now I'm going to do the big toes. So I'm going to say capillary refill, bilateral radial and bilateral great toe is less than 2 seconds. Or you can say less than 3 seconds. That's perfectly valid. Okay. So did I catch everything, you guys?
Yeah.
All right. Now we're going to move on to the GI one.
Do we need to say appropriate to ethnicity on the skin color?
You can do that, or you can say pink. I mean, we'll go either way.
When we do the lateral long sound on the fifth intercostal, is just the right?
Yep. Because remember, you're just going after the right middle lobe like before, like your head to toe. Okay. All right. Okay, Miss Barbara, can you please tell me your full name?
Barbara Bauer,
Okay. And what city are you in?
Denver, Colorado,
All right. And what day of the week is it?
Thursday.
Okay. All right. So, patient is alert and oriented to person, place, and time. And are you having any problems with indigestion or swallowing?
We had some heartburn.
Okay, all right. Okay, have you had any nausea or vomiting?
No.
Any constipation or diarrhea?
No.
Any problems urinating? Any problems urinating?
No.
Period. That's it. Okay. All right. So now what I'm going to do is I'm inspecting the abdomen, and again, you guys, you want to pull the gown up, and the abdomen looks flat, and it is equal bilaterally in symmetry. All right, and contour is appropriate. Okay, now I'm going to check the sclera again. This time I'm checking for signs of jaundice. So I'm going to check here. Okay. Sclera are clear, white and clear. Conjunctiva are pink and moist without signs of jaundice. Okay, so we do want you to let us know that that's what you're looking for. All right. All right, now I'm going to palpate, or I'm going to auscultate, I'm sorry. I'm going to auscultate your GI, I'm just going to auscultate your abdomen and just listen for bowel sounds. See if you're gurgling. And you guys, again, I start like at 7. If you think about the abdomen as a clock, start at 7 and go till 5. And then don't forget to catch on both sides, just go right below the rib cage. And you want to stay pretty much in an imaginary line from your nipple line on down to your groin. Because if you get too far out here, we cannot count you because the small and large intestines are all looped together right in this area here. So think about nipple line and don't go outside of that. All right. So now I need to just just kind of mash on your abdomen a little bit. Can you please bend your knees for me? Okay. Now remember, you guys, light palpation is only with one hand, okay? Don't do, I know at one point we were talking about it doesn't matter about whether you have both hands. It's just the depth of your palpation. That's not right. So for the purposes of passing this test, light palpation is just with the finger pads of 3 fingers. And you're going to basically go the same places where you went with your auscultating. Do you have, is this causing you any pain anywhere? No? Okay.
And I go to the bathroom, but
Okay. There is no tenderness or rigidity on light palpation. So you do have to divide your light versus deep palpations up, okay? All right, now I'm going to go, okay, now I have to kind of push in a little bit more. And you guys, we want to see you do at least 2 circles here at each point where you are palpating, okay? We want, and again, I don't care whether your dominant hand is on top, on the bottom. What we care about is that your technique is passable. Okay. So, no signs of masses or organomegaly on deep palpation. All right, and then, okay, well, I'm sorry, okay. When you are, no, you stay there. When you're going to palpate the bladder for distension, remember the bladder is clear down here, you guys. It's not up here. If you try to say that you're palpating for bladder distension up here, it's too high. All right. So you want to basically go from iliac crest to iliac crest if you want to draw an imaginary line, and then just do light palpation. But you're going to, a distended bladder feels like it's hard as a rock. Okay, you'll know when you felt one before, but you got to go low. All right, and then measuring the abdominal girth. Okay, hon, can you stand up for me? Again, we want to do this at the iliac crest. I know we kind of drummed that into you, I think, last week or whenever it was. So I want to see you guys palpating. Is that about where you're feeling it? Yep, okay. And then you can ask your partner to help you. You want to basically go to the umbilicus, and again, you're going to see that. And so then you're just going to go straight around, and you need to make sure that you're in a straight line with no twists of your tape. Okay, where you got it? Okay, whoops. Okay, and then you're just going to put it right over the front, and then you're going, and you don't have to tell me what somebody's abdominal girth is. If I see that, I mean, I don't want everybody to know. So, but if you've done it right and I see that, then, you're just going to say the abdominal girth has been measured.
And we're measuring it with the red.
Yes, with the inches, not centimeters, okay? On this particular one of you guys will get this at your station. Both sides are red, but one of them you're going to have red and black, and I do believe the inches are the red side there too. Okay? Okay. Questions? That's it.